Hello, everyone, and welcome to Question Lab. We hope everybody had a very happy new year, and we're happy you're joining us this evening as we discuss and dissect questions on the topic of pharmacology. Leading tonight's session once again is Dr. Paras Vicaria, and he's going to introduce himself to you now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I am a dermatology resident here in Dallas, Texas. I originally graduated from pharmacy school and then went on further to do medical school. I'm also an RX coach with USMLE-Rx, so I work one-on-one with students such as yourselves to help prepare you guys for the USMLE Step 1 and Step 2 CK as well. And I'm happy to help with tonight's presentation.
So without any further ado, let's go ahead and begin with our first question on the topic of pharmacology. As you can see, the answer choices are not there, and that is because it is done by design. We don't want you to see the answer choices because oftentimes it'll guide your thought process, it'll dictate your thinking, and we don't want that to happen. We also don't want you to see an answer choice that you are unfamiliar with that may cause you to panic as you're trying to answer questions on test day. So I've gone ahead and removed those answer choices, and we will begin with the lead-in, which is the last sentence or the question itself. And the reason we do that is because we want you to know what the test writer is asking while you read that vignette, so you can pick up on all those relevant clues and not have to waste valuable time on test day rereading the question. So let's begin with that lead-in now. Which of the following best describes the effect of this medication on myocardial action potential? Which of the following best describes the effect of this medication on myocardial action potential? After that, we'd like to ask our students how many steps they believe this question will require. And we do this so that you can keep an organized thought process and not miss any valuable steps on test day. So I'll give all of you a few moments here to respond in the question box and let us know how many steps you think this question will require. All right, I see some responses coming in. Let's go ahead and get it. Let's go ahead and read that vignette. A 60-year-old man comes to the emergency department with tremors and difficulty breathing. Several months ago, he was diagnosed with a supraventricular arrhythmia and started on a medication to manage the condition. Since then, he has lost several pounds, even though his activity levels have remained stable. Physical examination reveals an anxious patient wearing lightweight clothing despite cold ambient temperatures. Which of the following best describes the effect of this medication on myocardial action potential? I want you to start thinking about the important clues in the vignette and lead-in as I hand it off to Paras.
Thank you, Sean. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in, okay? So starting off, we have demographics, and that's usually the first thing you're going to get. So it's important to make note of that because that's going to clue you in into what things you should automatically be thinking about. Okay, so here we have a 60-year-old male. And then they tell us usually about why the patient's coming in. Why are they seeing the doctor? Why are they coming to the ER? And in this case, it's because of tremors and difficulty breathing. So a couple different signs there, okay? A lot of times they'll tell you how long it's been going on. In this case, they didn't, but they'll tell you if it's been going on acutely for a few minutes or chronically for a few months to a few years. So you would also want to make note of that, okay? In this case, we're told about irrelevant past medical history, so we want to make note of that. And then a new medication. So as you know, this is our pharmacology topic, so you definitely want to make note of that, okay? They give us some other pertinent signs that have happened since that situation. So you definitely want to make note of that. And because this lead-in is asking us about that medication, okay? This lead-in is asking us about the effect of the medication on myocardial action potential. So I think we've got to figure out, one, what is this medication that they're talking about? And two, what is its effect on myocardial action potential? So I think we have a nice two-step question here. So what we're going to do is we're going to go ahead and take a look at those answer choices. And what you see there are 5 answer choices. And when we go through answer choices, we actually recommend that you start at the top you start at the bottom and you work your way up to the top. So you start with answer choice E and work your way up to answer choice A. And the reason we do this is because a lot of times we'll see students who they'll start at the top, they'll see something they like, and they'll select it without having gone through all the choices. And then sometimes they'll get that question wrong. And so to avoid making this mistake and avoid biasing yourselves, we recommend doing it this way. So I'm going to go ahead and do that now. Answer choice E, shorter effective refractory period due to increased ion release from the sarcoplasmic reticulum. D, longer effective refractory period due to the blocking of voltage-gated slow potassium channels. C, increased duration of the effective refractory period due to increased permeability of potassium channels. B, higher resting potential secondary to increased activity of the sodium-potassium ATPase. And A, faster upstroke which leads to a more rapid depolarization. Now we do have some long answer choices here, so we'll leave these answer choices up here because the poll has some shortens the answer choices. So make sure you get a good look at these answer choices. We'll leave this up for a few seconds and then we'll go ahead and open up that poll.
Well, thank you, Paris. I'm going to go ahead and open up that poll, and for good measure, I'll read those answer choices out to you one more time. Answer choice E is shorter effective refractory period due to an increased ion release from the sarcoplasmic reticulum. D is longer effective refractory period due to the blocking of voltage-gated slow potassium channels. C, increased duration of the effective refractory period due to increased permeability of potassium channels. B, higher resting potential, secondary to increased activity of the sodium-potassium ATPase. And A, faster upstroke, which leads to a more rapid depolarization. I see the responses coming in. We'll give all of you a few more moments here. Remember that there is no penalty for guessing on test day, so you should never leave a question blank. And certainly no penalty tonight, so make sure you take your best shot. And don't worry, we will go over the correct and incorrect answer choices at the end. All right. Well, let's take a look and see what you selected. In first place with 45% was a longer effective refractory period due to the blocking of voltage-gated slow potassium channels. And in second place with 30% of you selecting was answer choice C, increased duration of the effective refractory period due to increased permeability of potassium channels. So let's take a look and see what the correct answer is. And the correct answer is indeed D, and 45% of you got it right. So great job, everyone. Let me hand it off to Paris.
Thank you, Sean. Yes, great job, guys. So we've got a couple steps here like we talked about. First, let's figure out that medication. Well, we actually have to do a little bit of detective work. And, you can see that this patient has some weight loss. They have tremors, and then also is wearing not a lot of, lightweight clothing, even when it's very cold. So hopefully you picked up on this as a patient in a hyperthyroid state, okay? And if you remember, there are a couple antiarrhythmics that can cause issues with the thyroid gland. And that most significantly, most importantly, is amiodarone, which is a class 3 antiarrhythmic, okay? So amiodarone can cause actually both, either hypo or hyperthyroidism. In this case, it was hyperthyroidism. So let's take a look at the next slide. It's a table from first aid looking at those class 3 antiarrhythmics. And you can see that amiodarone is an example of this, okay? And you can see that it prolongs the action potential duration and prolongs the ERP, or the effective refractory period. And what it does is it blocks potassium channels. As a result, you get a prolonging of the repolarization period. And you can see in that curve, the gray line, which is normal, how it gets prolonged and pushed out to the right in that blue curve. So that repolarization, by inhibiting the potassium channels, leads to a prolonged action potential and a prolonged effective refractory period. Okay? And so this is the goal of amiodarone in class 3 antiarrhythmics. Okay? And you can see there why amiodarone causes so much thyroid issues, because, as Sean is highlighting, it is consisting of iodine, which then can incorporate into the thyroid hormone and can lead to those abnormalities. Okay? So if we go back and take a look at our answer choice, you will now see why answer choice D is the best answer. Okay? Answer choice E is incorrect. This is not the mechanism of class 3 antiarrhythmics. Answer choice C, you do have an increased duration of the effective refractory period, but it's not because of permeability to potassium ions. It's because of blockage of slow potassium channels. So that last part of the answer choice is what makes answer choice C not a good answer. Answer choice B, this mechanism is not how class 3 antiarrhythmics work, as we just talked about. And then lastly, answer choice A, if anything, the patient would have a slower upstroke, not a faster upstroke. This is not the main mechanism of class 3 antiarrhythmics. So the best answer choice here is answer choice D. So great job on this question.
Thank you very much, Boris. Great explanation as always. Challenging question, but hopefully you've all learned and will master it going forward. Let's move on to our second question of the evening. As you can see, covered up, that is by design. And as always, we will begin with the lead-in. Which of the following adverse effects would be most likely with use of this drug? Which of the following adverse effects would be most likely with use of this drug? I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. I do see a question about any subscription specials coming up, and yes, there are. We have a special offer and a raffle at the end, so make sure you stick around. All right, I see the responses coming in. Let's take a look at that vignette. A 62-year-old man comes to the oncologist to discuss treatment options for a recently diagnosed testicular cancer. The oncologist recommends a drug that causes DNA strand breaks through the formation of free radicals. Which of the following adverse effects would be most likely with use of this drug? Boris.
Thank you, Sean. So now we're going to go ahead and take a look at this question. You can see it's a much shorter question, okay? But again, this is about a drug. As you read with that lead-in, it's going to be important as we go through this question to figure out and look for those clues pertaining to the drug, okay? So 1, we know this is an elderly gentleman. 2, we know this is a patient with testicular cancer. And then they also tell us about how this drug works, okay? So we've got a few steps. 1, we've got to figure out what this drug is based on the clues in the vignette. And then 2, what is a adverse effect that we would most likely see with this drug? So what are some of the adverse effects of this drug? So I think we've got a nice 2-step question here, okay? So let's go ahead and let's take a look at those answer choices. Once again, we're going to start at the bottom and we're going to work our way up to the top. Answer choice E, renal tubular cell toxicity. D, pulmonary fibrosis. C, myelosuppression. B, hemorrhagic cystitis. And A, crystal-induced acute kidney injury. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. Thank you, Boris. The poll is open. Once again, we'll wait until about 2/3 of you have responded. For those of you who are wondering, next week's topic is biochemistry. All right, I see the responses coming in. We'll give all of you a few more moments here. Looks pretty close so far. Let's take a look. Well, it was almost a tie. We got 36% of you saying pulmonary fibrosis and 35% of you saying myelosuppression. Let's take a look and see what the correct answer is. And the correct answer is D, and 36% of you selected it. If this question looks familiar, it is because we've done it in a previous pharmacology question lab. And with that, I'll hand it off to Paris.
Thank you, Sean. Great job, guys. So we've got to figure out a couple things here. So what is that drug? Well, one, they're probably getting at bleomycin, okay? It is a drug used for the treatment of Hodgkin's lymphoma and also testicular cancer. Okay, so let's go ahead, let's take a look at the next slide. You can see this is from our pharmacology oncology section in first aid. And bleomycin, it induces free radical formation that leads to breaks in DNA strands, which is exactly what the question was telling us. You can see there that one of its uses is testicular cancer. So that could have been another way in which you would have picked up that maybe this was bleomycin, okay? When you look at those adverse effects, one, pulmonary fibrosis, and two, skin hyperpigmentation, okay? So those are important side effects that you definitely want to know about for bleomycin. So let's go back, let's take a look at our answer choices. Hopefully you'll see now why answer choice D is the best answer. One other thing to note is the lead-in was asking us about most likely adverse effect. So keep in mind, you can always get asked a question about an adverse effect of a medication, and you may have answer choices where more than one of those is an adverse effect of the drug. So you need to keep in mind that they're asking about which one is most likely. So if there are more than one answer choices that are an adverse effect of a drug, which one is most common? Okay. So looking at the other answer choices, answer choice E, renal tubular cell toxicity, that would be something more common with platinum analogs like carboplatin, cisplatin. Myelosuppression, that you can see with a lot of chemotherapeutic agents. However, bleomycin actually causes minimal myelosuppression, so not as bad as the others. Answer choice B, hemorrhagic cystitis. Hopefully you guys picked up that this was cyclophosphamide or ifosfamide as well. Okay, those are alkylating agents. And then lastly, crystal-induced AKI or acute kidney injury. You can see that with methotrexate. Okay, so hopefully you guys see why answer choice D is the best answer here. And great job with this question as well.
Excellent. Thank you, Paris. Great job as always. If you're studying and you're struggling, or you just want to do better than you're doing now, if you want to reach your maximum peak potential and study more efficiently, if you're saying things to yourself like, I'm studying a lot, but it's just not translating into my results, the efforts don't match my results, or I should have gotten that right, I don't know why I got it wrong. If you want a personalized study plan, if you want to work on your test taking skills, reach out to us at rx-coach.com. We're one of the only tutoring companies who was actually in medical education before starting a tutoring company, which means we have a lot of data because we've authored our own resources. We even have our own assessments. So if you're studying for a comprehensive assessment or for a STEP exam, we will administer an assessment and then base your study plan on that performance. If not, if you're studying for in-school exams or shelf exams, we'll use your syllabus or learning objectives, and we'll make you a study plan based on the resources you currently have, as well as the ones we will give you access to. Okay. It is a one-on-one approach. We have highly trained certified tutors, just like Boris and Brenda, who you met this evening. And we have very, very competitive rates and packages. So if you want to reach out to us and talk to us about RX Coach and how it could help you along your journey, reach out to us at rx-coach or rx-coach.com. You can click on that free consultation tab, and you and I can have a discussion about the program and how it can benefit you. If you want some free advice, please visit us at firstaidteam.com, where you can download a study planner and have access to a lot of great free of charge information, some great articles, as well as notices about upcoming events. So with that, let's go ahead and get into our third question of the evening on the topic of pharmacology. Once again, the answer choices have been removed, and we will begin with the lead-in. Which of the following is the most likely adverse effect of this chemotherapeutic agent? Which of the following is the most likely adverse effect of this chemotherapeutic agent? I'll give all of you a few moments to respond in the question box and let us know how many steps you believe this question will require. So we'll move on to that vignette. All right, I see some responses coming in. Let's take a look at that vignette. A 68-year-old man comes to his physician because of cough, dyspnea, and weight loss. He is diagnosed with small cell carcinoma of the lung. Chemotherapy with a topoisomerase II inhibitor is started. Which of the following is the most likely adverse effect of this chemotherapeutic agent? Bart.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this lead-in, in this vignette and the lead-in. And again, as you've read that lead-in first with Sean, you know that this is talking about a chemotherapeutic agent or a drug. You definitely want to pick up on those clues in the vignette, pointing you to what that drug could be. So again, we've got an elderly male who's coming in to the physician because of a few signs. So you want to make note of that, okay? We were told what his diagnosis is, and we were told the class of medication that was started, okay? So we need to figure out, one, what is that drug? You know, we already know the class, so we may not really even need to know the drug, but that would help. And two, what is the most likely adverse effect of that drug or that class, okay? So let's go ahead, let's take a look at those answer choices and let's see what we're working with. And once again, I'm going to start at the bottom and work our way up to the top. Answer choice E, pulmonary fibrosis. D, peripheral neuropathy. C, memory and cognitive defects. B, hemorrhagic cystitis. And A, alopecia. So once again, we're going to go ahead and open up that poll. Go ahead and select an answer choice you think is the best answer. We'll talk about it in just a few seconds.
Excellent. Thank you, Boris. Once again, the poll is open. We'll wait until about 2/3 of you have responded. Don't forget that we do have a raffle and a special offer for all of you in attendance. You must be present to win, so make sure you stick around until the very end. All right, I see the responses coming in. We'll give all of you a few more moments here. All right, let's take a look and see what you selected. And once again, it was close. 38% of you selected peripheral neuropathy and 37% of you selected alopecia. So let's take a look and see what the correct answer is. And the correct answer is A, alopecia, and 37% of you got it right. So definitely a tough question. Let me hand it off to Paris.
Thank you, Sean. Definitely a tougher question. So let's take a look at what's going on in this question. So hopefully, you know, we're told about the class of medications, okay? This patient has a small cell cancer of the lung, okay? And is treated with a topoisomerase II inhibitor. So let's take a look. Let's take a look at that section in first aid that talks about topoisomerase inhibitors, okay? So we'll move to the next slide, and you'll see that there's a screenshot from first aid looking at that. And these are our topoisomerase inhibitors. And you can see that these all cause DNA degradation, okay? You can see that our topoisomerase II inhibitors include etoposide and tenofovir, okay? And these are used for testicular cancer, small cell lung cancer, which would also fit with our patient. And you can see there that some of the most common adverse effects include myelosuppression and alopecia. Okay. So if you take a look now at our answer choices, hopefully you can see why alopecia would be the best answer of those answer choices. Myelosuppression was not an answer choice. Okay. Now, the other answer choices, in case you selected that, pulmonary fibrosis, we talked about bleomycin, okay, busulfan as well. Peripheral neuropathy, that would be something usually caused by platinum analogs as well, like cisplatin. Memory and cognitive defects, those can be caused by a few things, such as hydroxyurea, methotrexate. And again, hemorrhagic cystitis would be cyclophosphamide, as we talked about, which is an alkylating agent. The best answer choice here is answer choice A. So hopefully you can see why that is the best answer. We will move on to the fourth question. Great job with this question.
Well, thank you, Paris. Great job, everyone. We're doing some challenging questions. You guys are doing extremely well, and hopefully Paris's explanations will help you master all this material for the big day. But more importantly, while you're in practice, let's tackle our last question of the evening. Let's try to finish strong. As always, we will begin with the lead-in. Which of the following changes in enzyme kinetics is most likely caused by use of this drug? Which of the following changes in enzyme kinetics is most likely caused by use of this drug? I'll give all of you a few moments to respond in the question box and let us know how many steps you believe this question will require. Then we'll move on to that vignette. All right, let's take a look at that vignette. A 54-year-old woman presents for follow-up of rheumatoid arthritis. The patient was taking hydroxychloroquine daily until 2 months ago. She discontinued the medication because she continued to have intense joint pain. On physical examination, her knees and finger joints are edematous and tender to palpation. Methotrexate is prescribed as an enzyme inhibitor. Which of the following changes in enzyme kinetics is most likely caused by use of this drug? Paris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so this is our fourth time doing that. So hopefully you guys are getting a sense of what are those important clues as you go through these pharmacology questions in order to get to the right answer, okay? So we are told now about an enzyme kinetic question, okay? We're told about this 54-year-old woman who was recently on hydroxychloroquine, okay? We're then told about a new medication, methotrexate. And then they're asking us about the change in enzyme kinetics that's most likely caused by this medication. So one, I think we need to know what kind of drug is this medication? How does it act? And then two, based on its mechanism of action, how is it going to change enzyme kinetics? Okay, so I think we've got a nice two-step question here. So let's go ahead and let's take a look at those answer choices for this question. Answer choice E significantly decreases the Michaelis-Menten constant. D increases the Michaelis-Menten constant. C increases maximum reaction rate. B has no effect on the Michaelis-Menten constant. And A decreases maximum reaction rate. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here. We'll talk about it in just a few seconds.
Excellent. Thank you, Paris. The poll is open. It's our last question of the night, so let's try to finish strong. Next week's topic, once again, is biochemistry, and we hope you'll join us. If you have any suggestions on which topics you'd like covered during these question labs, feel free to drop us a line in the question box. We'd love to hear from you. All right. A few more moments here. I see the responses coming in. And it's almost time for our raffle. Let's take a look and see what all of you selected. Like I said, it was close. 30% of you selected increases the Michaelis-Menten constant, while 25% of you said it significantly decreases it. So let's take a look and see the correct answer. The correct answer is D, and 30% of you got it right. Let me hand it off to Paris so he can explain it to us. Paris.
Thank you, Sean. Yes, definitely a tougher question. And you can see that definitely we're starting to get into some pharmacokinetics with this question, okay? So you can see there that curve that talks about the substrate concentration and the rate of reaction, okay? So it's important to know what methotrexate is. It is a reversible competitive inhibitor of DHFR, or dihydrofolate reductase. So a reversible competitive inhibitor, okay? And it reduces folates available for making your purines and pyrimidines, okay? So reversible competitive inhibitors will increase your Michaelis-Menten constant, okay? But it won't affect your Vmax. It can be overcome with a lot of substrate, okay? But you can see there in the presence of methotrexate, it's going to take more substrate or more folate to get to that maximum velocity. And because of that, your Michaelis-Menten constant, or Km, increases. You can see how it moves to the right on that x-axis, okay? So this is the Michaelis-Menten constant of that enzyme, and you can see how in the presence of a reversible competitive inhibitor, it is increased, okay? So the concentration of the enzyme needed it will also be increased. So let's take a look at the next slide, and this kind of goes through those enzyme kinetics, depending on if we're talking about a competitive inhibitor or a non-competitive inhibitor. And furthermore, if it is a competitive inhibitor, is it reversible or irreversible? In this case, we're talking about methotrexate. So we needed to know it was a reversible competitive inhibitor of DHFR, dihydrofolate reductase. So you can see there in that fifth row, effect on Km, or the Michaelis-Menten constant, is that it's going to increase it, okay? It will not decrease the Michaelis-Menten constant. The Michaelis-Menten constant will not stay the same or will not be unchanged, okay? The maximum reaction rate, or the Vmax, you can see there is unchanged, okay? So it does not decrease or increase. So hopefully you can see now why the other answer choices are incorrect. We'll go back, take a look at those other answer choices. So hopefully you can see now why in the presence of a reversible competitive inhibitor, there's no decrease of the Michaelis-Menten constant. It actually increases. And the Vmax, or maximum reaction rate, stays the same. It's unchanged. So great job with this question. Also a tougher kinetics question, but great job overall on these pharmacology questions tonight. And I'll hand it back to you, Sean.
Well, thank you very much, Paras, for all the wonderful explanations. If you want to review these questions on your own time to make sure you've mastered the material and are comfortable with it, feel free to take a screenshot or a picture or make note of these question IDs. You can log into QMax, click on the RX search field, type this number in, and it'll pull that question up for further review. I'll leave this up for a few more seconds.